Urinary catheters are essential tools used in medical settings to help drain urine from the bladder. A urinary catheter is inserted through the urethra and into the bladder. This procedure may be performed to collect sterile specimens or to determine how much urine remains in the bladder after urination. There are also retention or indwelling catheters, which are designed to remain in place to allow temporary or even permanent drainage of urine. This diagram illustrates the catheterization equipment used in urinary drainage. The tubing connects the catheter inserted into the bladder to a drainage bag. The balloon, when inflated, holds the catheter in place inside the bladder. The drainage bag collects urine and is typically secured to the patient's leg or bedside for monitoring and disposal. In OBGYN sonography, it's important that the bladder is full for optimal imaging. Patients who are unable to naturally fill their bladder may require catheterization to maintain bladder fullness throughout the exam. However, for transvaginal exams, bladder filling is not required as the probe provides sufficient proximity for clear imaging.
Foley catheters have two tubes, one inside the other. The inner tube is connected at one end to a small balloon. After the catheter is inserted into the urethra, the balloon is then filled with water or air to hold it in place. Urine drains from the bladder through the outer tube and collects in a container attached to the patient's bed or table. Clamping or unclamping the tubing controls the flow of urine. The catheter bag must always be lower than the patient's bladder. Catheterization is a sterile technique, and the catheter drainage system is a closed sterile system. Wound drains. Wound drains are plastic tubes that provide a way for fluid, blood, or air to drain out of the body. One end of a wound drain is placed within the wound, and the other may be connected to a suction collection device. The fluid may be collected in a draining bag, plastic bowl, or onto a dressing. Sonographers must be careful and avoid pulling or dislodging wound drains during a patient positioning or transfer.
Colostomy and ileostomy. Let's start with some basic definitions. A colostomy creates an opening from the colon to the outside of the body. An ileostomy creates an opening from the ileum, the end of the small intestine, to the outside. Both result in a stoma, which is covered by a disposable bag or pouch to collect the waste. Now let's move into the practical aspect of managing these stomas, particularly when preparing for or during a sonographic examination. It's important to use clean technique when caring for a colostomy or ileostomy site. Always use gloves to maintain hygiene and prevent infection. When preparing for a scan, gently remove the old appliance and clean the area around the stoma. Place a folded cloth pad or towel around the stoma to absorb discharge and protect the area. Empty the old appliance into the toilet and dispose of it properly, ideally in the plastic bag. Clean and dry the skin around the stoma before applying a new bag. We also need to be prepared for situations where there might be open wounds near the stomach, or if we need to scan directly over an open wound. In this case, sterile techniques is absolutely critical to prevent infection. To scan directly over an open wound, first, apply sterile gel directly to the wound area, then cover the gel and the wound with a protective thin plastic film. Finally, apply another layer of sterile gel to the top of this film. The second layer of the gel is essential to ensure an airless contact between the transducer and the scanning surface, allowing for optimal image quality without compromising sterility.
So now we'll be covering wound dressings. Wound dressings are materials that are used to cover wounds to support healing and prevent infection. The type of dressing chosen depends on the size, severity, and the goal of the treatment, whether it's just simply to protect the area or to manage things like moisture, infection, or tissue damage. Let's go over a few common types of wound dressings. So that includes gauze, transparent film, hydrocolloid dressings, foam dressings, alginate, hydrogel, and finally antimicrobial dressings. Gauze is the most basic type of wound dressing. It's very common, it's great for small, less severe wounds, and helps absorb fluid while providing basic protection. Next, we have transparent film, which is a clear, flexible dressing used on minor cuts, scrapes, or burns. It allows you to see the wound while keeping it protected from bacteria. Hydrocolloid dressings are used on minor or superficial wounds that aren't infected. They help maintain moisture, which speeds up healing. Now we have foam dressings, which are absorbent and ideal for thicker or more exuding wounds. They soak up fluids while cushioning the wound area. Alginate dressings, like the name, are made from seaweed and help create a moist healing environment, especially helpful for wounds that drain a lot. Hydrogel is a cooling gel used for dry or necrotic, which means dead tissue wounds. It hydrates the wound to help soften it up and remove the dead tissue. Finally, we have antimicrobial dressings, which are used for high-risk or infected wounds. They deliver agents like disinfectants, antiseptics, or antibiotics directly to the wound to prevent or fight infection. Choosing the right dressing can make a huge difference in how quickly and effectively a wound heals. Thank you for listening.
Bedpans. First, when handling bedpans, always follow medical asepsis, standard precautions, and bloodborne pathogen standards to protect yourself and your patients. If you're assisting a patient of childbearing age who's having heavy vaginal bleeding, check for any products of conception. This could indicate a miscarriage and must be reported right away. Also, keep an eye out for anything unusual in the waste, such as strange color, volume, or consistency, and report it. Sometimes you may be asked to save a sample for lab testing, so know your facility's procedures. Urinals. For male patients, urinals are typically used for urination. These have a cap and hook-like handle for easy use. Ideally, the patient should stand while using the urinal, but if that's not possible, you can sit at the edge of the bed or lie down. Always offer support that promotes dignity and comfort. Emesis basins. If a patient feels nauseated, immediately turn your head to the side to prevent aspiration. Place an emesis basin under their chin and observe the vomit. Note color, odor, and any food particles. If it looks like dark coffee grounds, that could signal internal bleeding and needs to be reported right away. You also may need